Hello everyone, it's Tuesday 1 o'clock. Well, it's a bit past 1 o'clock, so it's lunchtime with Dr. Poornima. So today we want to talk about dentures and a different type of dentures. So for example, last time we spoke about, we've been talking about missing teeth for a long time. So the options of missing teeth. Then last week we talked about specifically about dentures, and we talked about partial denture, it's a full denture, it's the types of dentures. Now what I'm going to talk about is overdentures and hybrid dentures. What does that mean? What does that mean by, what is an overdenture? So say for example, someone has no teeth and they have a full denture. Now the problem is with the lower denture, quite loose and it's quite wobbly, and you've got this massive tongue which actually lifts the denture all the time. So patients do use glue, and then they say, you know what, I don't want to use this anymore, don't really like it. What can we do? So depending on the cost, then depending on the bone availability, we can discuss options with them. So first thing is that the simplest thing we do is, if you see, this is like a cast. This is a full lower, edentulous mouth, which means there is no teeth at all. And then we use these two implants. So these implants are buried in their bone. And these two little things, okay? So we've got these attachments there, and the denture clicks on these implants. The patient has more rigidity, so it just clicks and then it doesn't move. So that is something we call an overdenture. So how do we do this? Now a patient may present with no, so basically they already have a denture, and that is an easy way to do because they already have a denture. Then we see the fit of the denture. For example, the denture may not fit very well, so we might have to probably make a new one or reline the denture. So it depends. We talked about reline last time. So what we then assess the bone. So we take the CT scan, we see how much bone there is, and for most people we can actually put these two implants where it's your canine teeth. They do have the maximum bone and the length there, so we can place these two implants. So the good thing about this is it's just implants, it's not more implants, so it's easier for the patient. Financially it's more cost effective. So we then, what we do is we do some implant planning. We then put the two implants in, and then the denture clicks on it. What's the time frame? Now ideally, if you want to do it the traditional way, we actually drill the bone, we put the implants in, allow it to heal. So we bury everything in, allow it to heal for 3 months, and then we uncover it after 3 months and we put these copings on. Basically the existing denture can click on, and while we are waiting for the implant to heal and osseointegrate, they can still use their denture. So they can still use their full mouth, the denture, and that's what patients like about it. And I said earlier, it's cost effective, so the patient is not spending a lot of monies, but they a little bit better than what they have at the moment. So let's look at some of the images so that you have a better understanding about what it looks like in the mouth. So that is called overdenture. So this is how it is. So say for example, you've got a gummy smile, and then you've got these two implants in, and you've got a ball connector, and this whole denture just clicks on that, and it's called an overdenture. Okay. Now the next thing is called a hybrid denture. What is a hybrid denture? Which means that for patients, they're like, well, they've got enough bone, cost is not too much of an issue. So what we can do is we'll say, well, we can use 4 implants at least. So 4 implants, and we then connect it. So this is fixed. Now the first one, which I showed you earlier, you can actually remove the denture. So it can come in and out. It's removable. So the good thing is you can clean it and you can actually maintain it. So So and also the ball bearings, you can actually clean that yourself, so that way we don't have any issues mostly with that. So it's easy to clean. Whereas this one here, look at that. So that's got more implants. So those are the implants there. This is a fixed, it's one prosthesis, and with this one we can actually make it out of different materials. Then we just place that and we screw everything in. So that's the 4 implants here. We screw everything in. So that is a fixed option for you. So this is called a fixed option because basically you don't have to do anything. It's actually fixed in the mouth, and you do need to once every 6 months to a year, depending on how good you clean your teeth. We actually, what we do is we can unscrew everything, clean everything underneath. So there will be a titanium bar. So underneath there'll be a nice titanium bars, which is easy to clean. We'll clean that and then we'll put everything back in. So what's good thing about this compared to a full fixed option? Now the full fixed option is something I'm going to talk about next time. It's going to be crown and bridge. So the good thing about that is we can remove it, easily cleanable. And say for example, now I normally like to put a few more implants if I can, and if one of them does fail for whatever reason, we can still use the prosthesis. So for the patient, we don't have to replace the implant if we don't need to, if we have loss of bone, but because the prosthesis can still remain as is and we can still use it. And also it's good for patients. Again, it's more cost effective, and it's also good for patients because easier to clean for them, but it's more fixed. And if their bone density is not that great, it's also a good option. So that's what now we want to talk about. So the 2 things is the overdenture, which looks like this. So you just get 2 implants. It's very cost effective. And then you have a full denture which clips on. Normally the 2 implants are really for your lower jaw, because the lower denture is the one which moves all the time. Or you can get a hybrid one which is more fixed, so you can't remove it. Remember, this one you can remove it yourself. So sometimes patients feel that, you know what, it doesn't feel like we've done implants in your mouth, because you can still remove it. So the whole thing about the fact that it is just a denture just annoys people. So the other thing, if you can afford a few more implants, and then we can do a fixed hybrid denture, which means the denture is screwed onto the implants and you don't have to worry about removing it. You can't remove it, so it's natural. You can clean it really well. And because the prosthesis is denture material, but the denture material, we can go through different kinds of materials to make it look more natural, then it feels like you've got a fixed prosthesis, and patients feel more confident. The only thing is we do need you to come in every 6 months to a year to unscrew them and then clean it all out, and then we can just fit that in again, just so that sometimes there's a lot of tartar, there might be tartar buildup underneath which you can't clean, so we can clean that up for you. So this is how it looks again on the underside of it. Okay, so the underside of it, these implants here. Now this whole denture, there's got a titanium bar, and these implants will be then screwed on to the implants below on these ones. So, but mind you, there will be more of these implants on the bone. Thank you, folks. I hope you enjoyed it. So we talked about the 2 options with the implant-retained dentures. So one is the overdenture, one is a hybrid denture. And next time we will talk about a full fixed option with implants. So we can just start talking about it, or we can look at the care of these. I think we should just, focus on how to take care of them and what to do and how to clean them. So at least you have a full picture and you can make an informed decision as to what you want to do. Now, if you like this video, please like, share or comment. And if you do want to reach out to us to have more information, our phone number here is 0294841913, or you can email us at info@hillsdentaldesign.com.au. This is Dr. Poornima from Hills Dental, where we love to make beautiful and healthy smiles. Thank you so much. See you next week. Bye.